Health Foundation Trust is in special measures. Well, there are other ways, of course, of delivering mental health services. And with us is Emma Edwards from Together for Mental Wellbeing, a mental health charity. The oldest mental health charity, Emma, 140 years worth of experience. I mean, you do work with this local trust, which you said is in special measures, but the bulk of your funding comes from the county council. What sort of services are working well?
Well, we work across a range of services. We deliver it in partnership with St Martin's Housing Trust and Norfolk and Waverley Mind, and it helps us utilise the expertise of each of our partners. We have supported housing services. We've got 5 across the county. We do community support services. We also have peer support is an integrated part of the contract.
Tell us more about that, peer support. That's people who've actually had mental health problems themselves, then going on to help others.
Yes, that's right. So we've had some amazing outcomes with people. So, for example, our peer supporters work alongside, our service users in the service, using their lived experience, because they're experts by experience, and that helps people then to develop the skills that they need to greater independence and well-being.
How then could the politicians of any political colour make your job better, make mental health services better for people in this part of the country?
I think, service user voice is extremely important. People, mental health is, so devastating to many people's lives, and it's really important that the next government invests in that, and, in services, and particularly for older people. There's a real gap in services for older people who have mental health needs, and so it's just really important. People are at the centre of everything that we do, the people we support, and it's so important that their voice is heard.
So with that in mind, you're offering help with registration to vote?
We are, yes. So all of our service users, obviously it will be completely impartial, and it is as the service user wishes, but we will be supporting them to register to vote, because it can be a daunting process. And people who have been vulnerable, who've not, gone out of their houses for years, need the support to feel comfortable in doing that. And, it's the people we support who are most affected by policy.
We've talked as well about the housing issues in this part of the country as well. I know that my colleagues at BBC Look East and local radio have done a lot on this, particularly in Great Yarmouth. How is that connected to mental health?
I mean, housing is a huge issue across the country. It's not just in Norfolk, it's everywhere. The lack of affordable, suitable housing is a real problem. People who've, and we've had some amazing success stories in our services where people, have done so well and they're ready to be completely independent, are then stifled by the lack of housing available. So I think it's so important in every way that, there is secure and safe housing for people to, continue their journey to improve well-being.
So, is it anything other than money that you need?
I think it's also about, we found in Norfolk as well, working in partnership with other organisations, and obviously, with the people that fund our services, to make sure that we are getting it right and we are able to support people in the most effective way possible. And I think it's important that there is some, continued joined up working and developing that.
How confident are you, though, with all the discussion that there's been about the importance of mental health and better services, that this is the election which will really bring a dividend?
Yeah, we're really hopeful, and I think mental health awareness and how it can impact all of us, has very much been, the awareness is much more evident, particularly in the working environment, and I think it's just we've really got to work on increasing that, across the population, and I think the best results and outcomes are always via everyone being involved, including the person themselves, because they are the best person to decide what's best for them.
Emma Edwards from Together for Mental Wellbeing, thank you very much for joining us.